Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. This is your opportunity to get your COVID questions answered. Today is Tuesday, December 1st. Happy last month of 2020. And I hope people had a good Thanksgiving, hopefully at home without bringing people into the household who didn't already live there. We are seeing some progress in our COVID numbers, so why don't we go ahead and take a quick look at our dashboard. As always, you can go to chicago.gov/coronavirus, and latest data is up at the top. You can also get there directly, chi.gov/COVID-. And if we pull it up, you see that our current positivity rate, that's our test positivity, is at about 11.6%. Now, that's still more than twice what we want it to be. We want it to get back down below 5%. But if you look, a week ago we were at 13.4%, and before that we were as high as 16%. So that's been some progress. Our tests are doing pretty well. That's this middle graph here. You can see beginning really with our second surge here in October, we went from doing just 7,000 to 8,000 tests a day. Major improvement and increase in terms of testing over the last couple of months. We peaked here at right around 19,000, and now that's fallen off just a little bit. Some of that is because we're picking up the dip of testing around Thanksgiving. We really don't see a lot of testing on that Thursday, Friday, Saturday, Sunday, except for people who maybe are sick enough to be in an emergency department. And there are some places still getting testing, but we expect to see some dip in testing related to Thanksgiving. Cases overall, we're at almost 160,000 diagnosed cases in Chicago residents. You can see here our 7-day rolling average is also coming down nicely. It's at 1,723. Again, much higher than we want it to be, like 5 times, even more than 5 times what we want it to be, but better than where we were. A week ago, we were at 2,100, and we peaked at nearly 2,400. Some of that drop, a little bit of that will be sort of following this decrease in the testing. And the big question will be, how will Thanksgiving gathering really impact some of this progress? There's a worry that at the national level, potentially here at the local level, we may lose some of that progress, but we won't see it yet. It won't show up in the data, probably starting later this week and kind of into next week. So very pleased to be seeing some progress there. If we click over to some of the daily data, and we'll break it up here by race ethnicity, you can see that across all race ethnicities here, I'm going to change it so we're just looking at like the last couple months of data or so. Across all race ethnicities here, we're seeing nice decline. Blue here is Latinx Chicagoans, still really leading in terms of numbers of new COVID cases, but the best improvement in that group as well. Yellow is other non-Latinx Chicagoans. Then red here is white non-Latinx, purple is black non-Latinx, and green is Asian non-Latinx. So you can see, across all race ethnicities, some early signs of improvement, but a very, very long way to go. Deaths, on the other hand, here are still high. They're at 15 per day right now. You can see last week they were at 16. Regardless, those are up from 2 to 3 a day if we look back a couple of months, and those have not shown any signs yet of plateauing. We would expect the more serious outcomes, the hospitalizations and the deaths, to take some time to come down. And in fact, that is what we're seeing. Hospitalizations, the increase has started to slow, perhaps plateau a little bit, but we're worried with some of the surging around us still, in some of the suburban areas in particular. If those hospitals are filling up more, we will sometimes get, especially some of the sicker patients, transferred into some of our kind of higher acuity, our hospitals that can handle some of the sickest patients for COVID here in Chicago. So keeping an eye on that, but feeling hopeful that we are seeing some improvement, certainly. And if you look, this is just the last 2 months between September 30 and then it's running through November 30 through yesterday. You can see on deaths here, for example, 169 have been in Latino, 145 in Black, 148 in White. 13 in Asian. That distribution has been really throughout the city as well. Positivity, though, remains really, particularly among Latinx Chicagoans, the highest at almost 25%. There are a lot that are unknown, and we know that positivity is lower. And so, in fact, we know the actual positivity among Latinx is lower than the 25%, just as it's lower among the other race ethnicity groups, because those unknowns are distributed across the groups. We've done some analysis looking at that, and but regardless, the differences are significant. So CDPH is continuing to push testing resources very much to the areas of the city where we're seeing the most surging, seeing the highest positivity, seeing the most cases. That does remain predominantly Northwest and Southwest, especially in some of our heavily Latinx areas. Those, again, areas where there's a lot of essential workers, some larger families, more crowded housing, and we see those effects playing out in some of our data here. Okay, so I encourage you to explore more here if you're interested. You can look at age, and you can see that all of the ages similarly are coming down. 40 to 49-year-olds in yellow here are our most impacted group, and actually our highest outside of the kids for positivity too. So that is concerning. The gray and the pink here are our 70 plus and 80 plus. I'll blow it up. And you can see that is coming down, but not as sharply as we're seeing some of the other age groups. And these are the groups most likely to have the serious outcomes or get hospitalized. So some early signs definitely of progress, a long way to go. But thank you to everybody who has been really doing the right thing and limiting the risk of COVID here in Chicago. We are at about between 1 in 19 and 1 in 27 Chicagoans are estimated to have COVID right now, where we look at the number of people who have been diagnosed in the last 14 days or the last 30 days if they're hospitalized, and multiply that by the 5 to 7 times that we think is accurate for how many people have COVID but have not been diagnosed. So still a lot of COVID, improvement from where we were, but not the time to be letting up on that. And as a reminder, our stay-at-home advisory is in place through the middle of December, and we'll continue to assess where that is. Okay, so let's go ahead and turn to your questions. As a reminder, you can put them directly into the box below. You can put them on either Facebook or Twitter with the hashtag AskDrArwady. Okay. Jude Kamler on Facebook. What do you think about at-home testing kits, such as the one produced by Pixel by LabCorp? So I think they are a fantastic idea. And if you actually go to chicago.gov/coronavirus and you go to the testing link, you'll see that one of the main options that we map there any place that has public testing access. We also include a lot of more details about testing, but we've put right on there specifics about how to get these at-home test kits. They've been FDA approved. They are the PCR tests. So they're the gold standard tests. They're just as good as any test that you would get at a doctor's office or at the CDPH testing clinic. And the idea of these, and Pixel by LabCorp in particular, I have been pleased by, because you can go to the website. Again, the link is on the Chicago's coronavirus page. We also link to other companies that are doing this, but the reason Pixel by LabCorp has been good is that they've figured out how to bill your insurance, or if you're not insured, if you provide information to bill the pool of money set up at the federal government to help cover the cost of uninsured tests. So if you go, and I tried this out because I wanted to make sure I understood what happens with it. You basically fill out a short questionnaire that's just about symptoms that you may or may not have, exposures that you may or may not have, and any risk factors that you may or may not have. And then you put in your insurance information, or if you don't have insurance information, your kind of ID information, and then they will send you free of charge through the mail a self-collected kit and it's a nasal kit. It's not the deep swab. It's a little Q-tip that goes in your nose, just in the tip of your nose here, and you swirl it around, and there's directions in there. You put it in the little vial, and then it goes right back via, I think it's FedEx, but it's one of the commercial carriers, and you send it off, and then they run it at their lab, and you should get results really just within a day or two is what they're recommending. So I know people who have actually started, we've been thinking about this concept of sort of ordering these. If even if somebody has just the very beginnings of symptoms, remember, we want you home if you're having symptoms. Ordering that test straight away, you get it at home. You're able to get that test, send it out, get a result without ever even leaving your house. So certainly if somebody's more seriously ill, we want you going to get medical attention. But I am a big fan of the at-home testing kits, and we really are seeing the testing technology continue to evolve. Just recently, the FDA approved the first, or gave an emergency use authorization to the first rapid at-home testing technology. That is not yet widely available, commercially available. When it is, we will certainly be linking to that as well. But I do think that we are, just as we've seen improvements in a lot of other areas, we're going to really see, I think, testing technology continue to improve by leaps and bounds, and hopefully that accessibility too. There's a lot of commitment to making sure COVID testing remains free of charge for people who need it. So yes, recommend it, check it out, order it, have it, use it. And CDPH does get those results reported because LabCorp is one of the regular laboratories that has to report to the health department. Nancy V on Facebook is asking, will people who have had COVID need to get the vaccine? Does the answer change depending on how long ago they had it? Okay, so the short answer is that based on everything we know now, people who have had COVID will need to get the vaccine. And that's because there are a lot of unknowns still related to people who had natural exposure to the vaccine. We've talked a lot about antibodies that develop, which are one part of the immune system that can help fight off COVID. We know that those antibodies last, but they don't last perhaps indefinitely. There's a lot of variability depending on how much virus somebody was exposed to, how sick somebody got. If somebody didn't get very sick, their immune system didn't necessarily mount a very strong response. There's questions about how long any protection may last. So at this point, the CDC and really all of the vaccine experts have definitely suggested that we're not going to be taking into account prior COVID exposure. We will be recommending the vaccine for everybody because that's been done in a much more controlled way where you're giving people something that's been designed to actually create a predictable immune response and create a predictable amount of protection. So good question. And at this point, yeah, the answer won't change depending on how long ago you had it, but that's exactly the point, that somebody who had it a year ago versus somebody who had it last month, you would have different amounts, and it makes it pretty unpredictable to know what that protection level will be. So based on what we know now, we're not taking into account any prior COVID exposure. And this is actually interesting because it links to where we're prioritizing vaccine distribution. The CDC and the Advisory Committee on Immunization Practices through CDC makes the actual recommendations for prioritization, which everybody then has to use. And the first priority goes to healthcare workers, especially in hospitals, but then really right up there, we're expecting them to recommend it for long-term care facilities. And we've been planning for that to make sure that our Chicago nursing homes, assisted living, skilled nursing facilities are all enrolled so that both staff and residents can get that vaccine really early, as long as the safety data looks good for it and as long as the ACIP recommends it. And we know that COVID really swept through nursing homes in very serious ways, particularly back in the spring. But we have seen real increases again in cases in nursing homes. It's been one of the things that the health department here has really prioritized whenever we're seeing even individual cases. But we are having some outbreaks again, just as we are in so many of our settings where there's this much COVID around. And that's an example where you definitely would not sort of say, oh, I think this person had COVID, or we know they had COVID. No, we definitely want people really pretty universally to be offered vaccine and strongly recommended to take vaccine in those settings. We don't don't rely on the fact that there was a lot of COVID in the area before. And for parts of the city that have been hit harder, those tend to have more essential workers. Those will also, we expect through ACIP, essential workers, be one of the prioritized groups, not with healthcare workers, but probably shortly thereafter as vaccine becomes available. And absolutely, I want people who are essential workers and out and about getting that COVID vaccine, as long as it's been proven to be safe and effective, et cetera, because we want to really develop some hopefully longer lasting and more predictable immunity. Mandy Cam on Facebook, same question. If you had COVID, can you still get the vaccine? Yes, and that will be a big part of our messaging. Face State on Facebook, are the statistics from in-home testing included in Chicago and Illinois statistics? Yes, those are all, they go to regular labs and they get reported to us, and no matter where and how you get tested, if you're a Chicago resident, it gets reported to the Chicago Department of Public Health. The difference would be once we start to get to some of these point of care, like immediate results, there are some questions there about how some of that might or might not be reported. But like the one I was just describing, where you're sending the results into a laboratory, all of those laboratory results do get reported. And I think as we see more of these point of care tests, particularly at home ones, we may be at a point a few months from now where you'll be able to go to CVS and just pick up a pack of, rapid tests and use them before, you have a family over for dinner. We're not there yet, but the expectation is that amount of testing, probably we would lose a lot of the reporting. We'd lose a lot of ability to count individual tests, but the feeling is that the improvement it would probably have in terms of limiting spread and really making testing more available would probably be worth it. And we'd use some of the other strategies that we use, like for example around flu, where we don't always count every single flu case, but we have ways of testing samples that come in to see what percentage are positive for flu. And we certainly count people with flu who are admitted to the ICU or who die, but we're not there yet. We're still at a point where we are really looking to track every case. But as the testing landscape evolves, that may be something that continues. Good question. Gabriel Hernandez from Facebook, if you catch it once, will the next time be less painful? Also, how long can my immunity last? And when I survive, does it mean I still have to get vaccinated? So yes, you would still be recommended to get vaccinated. These are exactly some of the questions that are under study right now. We do think that people who would have had it once probably would have less of a severe response the next time, but we do not know that for sure. There's also some concern that where your immune system has been primed, particularly around a natural infection, you can actually have a more robust immune response the next time. So these are some of the things that are very much being studied. We certainly have seen examples, hundreds of examples now, of people getting reinfected with COVID. Sometimes, we know that there's been a little bit of a we know that for sure, if we can look to see there's been a little bit of genetic difference, like in the RNA fingerprint of the two different viruses that they were exposed to and infected with. We still think it's relatively rare, but the jury is still very much out. And so that's why the strong recommendation is, even if you've had COVID, we really need you wearing your mask, keeping your distance, protecting those who are more vulnerable, because it is not thought to be really a long-lasting or fully protective immunity. Like the hope is a vaccine will be more like that. So the CDC really says immunity, immunity or some protection. Think about it for about 3 months or so. A lot of questions about what comes after that. And some of the most interesting science just is continuing to emerge there. But for everybody, in terms of what this means for my life, it means if you've had COVID once and recovered, you shouldn't assume that you can't get it again, and you should continue to be careful and do the things that we know help protect everybody. Jean Martin, let's see, or Jenny Martin on Facebook. Oops, sorry. Will the vaccine be a yearly vaccine or one and done? In other words, how often will we have to get it? Okay, excellent question. So of the 6 vaccines that are being studied in the US, 2 are currently at the FDA for evaluation and may get an emergency use authorization. The Pfizer is being considered on February 10th. We've heard the Moderna will likely be considered on, I'm sorry, not February. The Pfizer is being considered on December 10th, and the Moderna is likely going to be considered on December 17th. Both of those are 2-dose vaccines, but they're doses that come very close together. So you get one shot, and then you get the second shot either 21 or 28 days later, depending on the vaccine. And that's sort of, the first one is meant to prime the immune system a little bit. The second one sort of finishes the protection. And of the 6 that are in trials in the US, 5 of them are 2-dose. The Johnson & Johnson one, which is at least a few months further back, is the only one that is a 1-dose vaccine. So first and foremost, it is a 2-dose vaccine from the beginning. And we don't yet know how long for sure immunity would be thought to last. Certainly, the experts are predicting it would be at least a year that it would last. There are some who are thinking, based on what we are seeing in sort of the immune response in people in the trials, that this could be a many-year vaccine. I've seen estimates as high as 9 or 10 years, which would be something like a tetanus vaccine, where you have to get a booster every 10 years. Even if this turned out to be a yearly thing, like we do for the flu, that would still be a big improvement. But I think people are hoping that it's not going to be yearly, that it would be a longer lasting form of immunity. But remember, we haven't even had COVID in the world for a year yet. And so there's just not been the time. The vaccines, even the very earliest versions of the vaccines, we've been following for the order of months. And people who are in those trials will continue to be in the trials, and then people who get it in the real world will also continue to be monitored to be able to answer exactly those kinds of questions. So we don't know for sure. My hope, and a lot of the data is looking fairly optimistic, that this will be really more protective. And honestly, the preliminary data, we're waiting to see the formal data from the FDA, of course, but the preliminary data that's been released has been surprisingly good, I will just say. The FDA has said that they would give an emergency use authorization to a vaccine that first and foremost showed it was safe, but secondly showed it was at least 50% effective in terms of being protective. And the fact that both of these first 2 vaccines, in terms of the limited data we've seen to date, have like a 95% efficacy is surprisingly good. I was looking at the data for Moderna this morning, and if you saw this, they had done nearly 200 people now in the 30,000 trial had gotten COVID, and that's what we follow for, right? Like, you wait until a certain number of people get COVID in the trial, and then you unblind it and you look to see how many of them got the real vaccine versus the placebo. And it was, it was, I forget the exact number, but it was 175 who had gotten COVID were in the placebo group, and 11 were in the vaccine group. That's really, really good in terms of numbers. And importantly, there were 30 people who'd gotten more severe COVID, like bad enough to be hospitalized. One person had even died. All of those people were in the placebo group, not the vaccine group. And so the vaccine was not only protective against COVID, but even more importantly, it looked like it was protective against severe COVID. The preliminary data looked like it was, and again, we have to wait to see the formal data, but this is what's been released. Looked like it was good for people who were older, looked like it was good across race, ethnicity groups. These are some of the questions we'll be wanting more details on. But it's really looking very effective, and then importantly, no severe side effects, and that's the most important thing. As this rolls out, of course, very widely, there will be a lot of follow-up of people who are getting the vaccine in real time to look for what side effects they are having. We are seeing some reports of sore arms or some flu-like, that your immune system can mount a response. So kind of like some people after they get the flu vaccine feel a little bit under the weather for a day or two. These are exactly the kind of data we want to see related to people who are in this vaccine trial, so that we can be really honest about potential side effects. But no, there were not reports of serious side effects, and it is not possible to get COVID from this vaccine because of the way it's developed. There's no actual COVID even killed or inactivated that goes into the body. How close, Kristen Lenda on Facebook, how closely is Illinois working with the CDC on distribution efforts? How quickly will this be available for lower risk? The Illinois and actually the city of Chicago are working very closely with the CDC on distribution efforts. The way that this works actually is that the city, Chicago, will directly receive vaccine through CDC, and then the state of Illinois will receive vaccine for areas outside of Chicago. And that's because that's how all of the traditional vaccination structures are set up. So all of our childhood vaccines, flu vaccines, come in that way. And so there's been a lot of work every single day, calls and planning. There's still a lot of unknowns, to be honest, in terms of exactly how many doses and exactly what time frame and exactly what protocols. We are very ready here in Chicago to accept whatever amount of vaccine is made available to us. There have been exercises going on even right now about shipping empty boxes and proving that we can do the ultra cold storage, which we can. We've done a lot of very specific planning here. For example, with our hospitals, there's 37 hospitals in Chicago, including the specialty hospitals, and that's where our first distribution of vaccine will go, not for patients, but for the healthcare workers at those hospitals. And so we've been working, which of these hospitals have some of that ultra cold capacity. Even the ones that don't, the health department will be receiving that and then shipping it and figuring out all the logistics of what that looks like. We've been working with all of our long-term care facilities. There's about 130 in Chicago. That is all happening with some direct shipment. There's a pharmacy partner that's working to do strike teams there. So, we're not going to pull the people out of the long-term care facilities. We want to bring vaccine there. So there's a lot of planning that's happening. And we'll see. We'll see how quickly vaccine can sort of get shipped. We're still anticipating more funding, frankly, to help support vaccine distribution efforts, because there's not been much funding. But we are using the channels that we have, and it's really an all-city effort to do this well. So yes, you'll be hearing much more about this as it rolls out, but we're expecting, potentially as soon as the third week in December. So really just a couple of weeks from now, probably third or fourth week, be at a point where we're starting some distribution, starting to put vaccine in arms here in Chicago. And, really, really excited about the beginning of that. Oh, and then you asked how quickly will it be available for lower risk. I don't know for sure. My expectation, and again, this will be up to the Advisory Committee on Immunization Practices, the ACIP, will make these recommendations about time frame. But we're expecting, healthcare workers, sort of first and foremost, the long-term care facilities, and then likely essential workers, people with underlying conditions, people over 65, and then I'm guessing it will be more later in the spring, where we'll be able to more broadly move beyond some of that. But it's all going to depend on how quickly vaccines get that approval, how quickly they can be manufactured and distributed, how well the other vaccine candidates do in the trials. We have to make sure vaccines are safe and effective before we can recommend them. So what we're kind of thinking is, we're excited. I do think we'll get started here in a fairly limited way in December, and then every week we'll be reporting out on how much more vaccine we're getting, who that's going to be prioritized for. And I think I'm imagining sort of later in the spring, probably getting more into general population. And then summer really is where we're thinking maybe children, for example, may be part of the pool to be vaccinated. But a lot of that is just dependent on vaccine production and how well the vaccine trials do. So Denise Sims on Facebook says, what do I think about Black and brown people getting the vaccine first after first responders and 65 and older people living in nursing homes and assisted living? I ask this because Black and brown are affected the most by COVID-19. Yeah, so this, equity and really recognizing which groups have been most impacted by COVID-19 has been a big part of the conversation. And what we've seen, here in Chicago is very much what's been seen nationally. So part of the reason for the thinking that ACIP and CDC are doing around thinking about those essential workers really in that next category is that we do have overrepresentation of Black and brown workers in that essential worker category. This includes, the people who work at the grocery stores and work on transportation and work in education and work in healthcare, work in support, all of these same essential services as were defined back under stay at home. And those were, again, defined at the federal level. There's good sort of over-representation of some of the groups that have been most impacted. Even now, right? Early on, I was talking about how we're still seeing a lot of cases in heavily Latinx neighborhoods here, and we've disproportionately seen deaths in Black Chicagoans if we look over the whole outbreak. So we don't set those priorities here locally. They're set nationally. They won't be set by race, ethnicity. They'll be set by risk factor or job type. But the city of Chicago works to implement this. And so we will certainly be working a lot with, and we'll be talking more about this as this becomes more widely available, but working to really make sure that Black Chicagoans in particular, we are pairing healthcare leaders with trusted community leaders, having lots of opportunities to answer questions, explain the vaccine processes, talk about vaccine hesitancy and questions, talk about that history, really try to create a space so that assuming a vaccine is safe and effective, communities that have been hardest hit will have that uptake. And just like we've pushed testing resources to communities where we've most seen that hit, once the city is standing up more public spaces for vaccination, we will prioritize some outreach in those neighborhoods. But the other thing is, as more vaccine is available, we are absolutely going to be pushing this to providers, right? We're going to want your doctor, your clinic, your pharmacy to be able to vaccinate that population. And so just like we do for flu vaccine, the city will play a relatively smaller role in the whole scheme. We play a larger role at the beginning where vaccine is quite limited, but as it's more available, we'll really be pushing it out to clinical partners and encouraging people to get vaccinated through their trusted healthcare partners and then supporting healthcare partners in that. So that's a little bit down the line, but I really appreciate the question because we're anticipating, based on some national survey data and others, that without some real concerted effort in both Black and Latinx communities, we may not see as much uptake there. And knowing that those communities have been hardest hit, I feel pretty strongly about really talking about that exclusively. Some of you have met Dr. Robinson. She's our lead on immunization. She's talked about this some, and actually we're doing a sort of a press conference update this afternoon. She's going to be there talking about vaccine as well. All right. What else have we got? Gary Emerson on Facebook. Why is it that COVID has high numbers, yet they follow a lot of the same symptoms as the flu, and our flu numbers seem to be down? And then with deaths, why are underlying conditions not a factor in the root cause of the death? Okay, so two different questions there. So first of all, so Chicago Department of Public Health publishes all of our flu data every single week. So you can go chicago.gov/flu. You can get there off the coronavirus website too, and see every single week we post exactly how many flu cases we have hospitalized, what that data looks like. We have not seen at this point a significant increase in flu, which is good because our hospitals, we've got more than 1,000 people in the non-ICU, another almost 300 in the ICU, a lot of patients with with COVID in Chicago hospitals. We don't usually see our flu spike come until more December and really January, February. We're hopeful that with all of the social distancing, masking, hand washing, and flu vaccine that people are doing, that we won't see as large of a surge as we have last year. But I'm really worried about when that comes. Flu season, when it comes, does tend to put a lot of people in the hospital. So COVID and flu are two completely different viruses. There is no protection from COVID if you get the flu. There is no protection from flu if you get COVID. And we've had, 5 times as many people or more really dying from COVID. I saw a statistic that nationally, the number of people that have died from COVID already in the U.S. is more than 5 times, is as many people as have died in the last 5 years from flu in the U.S. And we unfortunately have seen just quite a bit higher mortality, meaning death related to COVID, than we have from flu. And that estimate is anywhere in the 5 to 10 times rate. So as we see more flu here, I encourage you to check out that data if you like. We do update it every week. We'll start talking about how flu and COVID may play a role, but there's not an intersection. It's just that they both hit the healthcare system at the same time. And then on the second question, why are underlying conditions not a factor in the root cause of the death? So we do report out on underlying conditions, and about 90% of the people still, and that's been true from very early on, who die of COVID do have underlying conditions. Now, whether that's, diabetes or hypertension or heart disease, obesity has turned out to be a risk factor for this. But it is but on the death certificate, it is the COVID, and this is what the doctor certifies. COVID was the cause of death. So if I have congestive heart failure and diabetes and asthma and a lot of underlying health conditions. If I get COVID, I am more likely to die from COVID than someone who didn't have those underlying conditions, but I also would not have died if I didn't get COVID. Does that make sense? So the actual death certificate will list COVID, and then will often list contributing conditions under there. So that's available, and that is how we track that nationally. So I hope that answers the question. Okay, we're just about out of time. It always goes fast when we start answering questions. I think we'll take Adrian Hegel from Facebook. Are teachers in an early wave of people who can get the vaccine? Could they be prioritized to limit the risk to adults in school and help keep schools open? So all of you know that we really are proponents of in-person education as long as it can be done safely. And we've had very good success here with having schools open in Chicago without significant outbreaks and without significant spread. And so certainly CPS, for example, is aiming to start bringing back some students in January. And as long as we've seen continued stabilization of the outbreak like we're seeing right now, that's absolutely something that we're in support of with all of the protective measures in place. That said, teachers would fall in that essential worker category. And so again, this is premature because we have to wait for the federal recommendation. The ACIP will be making, through CDC, will be making these recommendations and will be implementing them, but the preliminary conversation does look like that teachers would be included in those essential workers, and those have been defined through CISA.org. You can look it up if you're interested, which means that they would potentially be in an earlier round of vaccination, where we don't think at all it makes sense to wait for a vaccine to have school open in person, but that will be a portion, certainly, probably over the second semester, where we will have more ability to vaccinate adults in those school settings. The children still, the trials won't be done, and they're at much lower risk for getting those severe outcomes, so they will come later. But for adults in school settings, I would expect probably in the springtime there to be some vaccination beginning there. And again, we're planning, but without specific timelines yet, because we don't know how quickly we're going to get vaccine, how many other vaccines may be approved. So all of our planning assumptions can really flex from a few thousand to many thousand and change sort of over the weeks. Okay, I think we are actually at time. If we didn't get to your question, we will try to pick it up on Thursday. But thanks for the good questions today. Some good news. So we do have a press conference today at 1. We'll just be going over some of the data, answering questions from the press, talking a little bit more about vaccine planning. Pretty much every time, I think, from now on, we'll be giving some updates as we have them available for vaccine. So as a reminder, if you are interested in being part of our efforts to continue to promote good coronavirus behavior, to eventually be spreading information about vaccine as it becomes available and push it out, you can go to chai.gov/protect. Protect Chicago is our name for our initiative right now that is pushing out information. We've got door-to-door things going on in the census tracts most affected. We're doing some text messaging and we're doing some calling, really working to have both breadth of information as well as depth in the areas that we need it. And you can sign up if you're interested to volunteer to be part of that group. If you, for example, volunteered around the election, around some outreach there's the ability to reach out via text or via phone or via postcard. We're replicating some of that related to outreach here. So go to chai.gov/protect and sign up. We've had more than 1,000 people sign up to volunteer, and there's a lot that you can do right from your own home if you'd like to be part of that. And it'll be part of our vaccine efforts. So just as a reminder, the stay-at-home advisory is still in effect. You should not be having guests over into your home still. This just is in place. You should be staying home except for work, school, or really essential reasons, and you should be avoiding unnecessary travel. And then finally, the last thing is, as a reminder, we're about halfway through our Takeout Chicago challenge. That's #TakeoutChicago. This is really, we're putting forward for people who are able to afford it, if you can get takeout from 10 bars or restaurants between mid-September and mid-November and mid-December, so between December 15th, you go to chicago.gov/takeout and you just put in, here's where I got takeout from, and you'll be entered into some drawings to win some pretty cool Chicago experiences, like behind-the-scenes tours of Soldier Field and various museums. These aren't for now; these are for later when we're back open again. But I got some takeout for my Thanksgiving meal, and I actually got it from 4 different restaurants at the same time. There was kind of a combination package down in Pilsen that I thought was pretty cool. But I've been using the excuse of supporting local businesses to get a lot of good food in. And for those of you who can afford it, really, asking you to try to do what you can to support bars and restaurants. Certainly if you're doing holiday shopping, try to support local businesses in that regard too. Many of them have worked to make sure that things are available online or for curbside pickup. And just recognizing that our businesses, really are continuing to suffer economically a lot, and starting to see some good progress in our numbers is the first step toward us being able to really get some of those businesses open again. So the decisions you make every day also are helpful economically, and we're seeing some of that same improvement even in some of the areas around us that have been doing very poorly. So some early signs of hope. We'll see what the post-Thanksgiving fallout is, but asking you not to let down your guard, even though we're post-Thanksgiving. We are under that stay-at-home advisory, through mid-December, and we'll see where we are from there. So with that, thanks for tuning in. We will be back on Thursday at 11 a.m. Sybil Madison, I believe, will be back with us, and we'll have some conversation and take more of your questions. Thanks, and be safe, Chicago.